Tennis elbow, medically known as lateral epicondylitis, is a common condition that affects millions of people worldwide, not just athletes. This condition stems from repetitive stress and overuse of the forearm muscles and tendons, leading to pain and tenderness on the outside of the elbow. Understanding tennis elbow, its causes, symptoms, and the most effective treatment options is crucial for those affected. What is tennis elbow? Tennis elbow is characterized by pain in the elbow and arm due to overused muscles in the forearm. This repetitive motion can cause tiny tears in the tendon attachment at the elbow. Despite its name, tennis players are not the only ones who suffer from this. Painters, plumbers, and carpenters are also at risk. Causes of tennis elbow. The primary cause of tennis elbow is repetitive motion involving the arms, specifically the twisting of the wrist and the extension of the forearm. Activities that can lead to this condition include playing racket sports, repeated use of plumbing tools, painting, cutting up cooking ingredients, particularly meats, repetitive computer mouse use. Symptoms of tennis elbow. The most common symptom of tennis elbow is a pain and tenderness on the outside of the elbow. This pain may also extend into the forearm and wrist, especially when lifting objects, making a fist or gripping an object, opening a door or shaking hands, raising the hand or straightening the wrist. Diagnosing tennis elbow. Diagnosis typically involves a physical examination where the doctor will test for pain in the elbow, stiffness, or discomfort while performing certain movements. An X-ray might be used to rule out other conditions, and occasionally an MRI or ultrasound is used to assess the damaged muscle tissue. Treatment options. Treatment aims to relieve pain and restore mobility to the affected arm. Here are some effective treatment methods. Rest and ice. Resting the arm and applying ice packs can reduce swelling and pain. Over-the-counter pain relievers, medications like ibuprofen and aspirin can help manage pain and inflammation. Physical therapy. Specific exercises can stretch and strengthen the forearm muscles. Braces or straps. These can reduce stress on the injured tissue. Steroid injections. These are used in severe cases to reduce inflammation. Surgery. This is considered if the pain does not improve with other treatments after a year. Prevention tips. Preventing tennis elbow involves reducing the strain placed on the elbows. Strengthen muscles. Regularly exercising the arm muscles can help to prevent injury. Use proper technique. For sports, this might mean training with a coach to ensure correct form and technique. Take breaks. Regular breaks during any repetitive activity can help reduce strain. Conclusion. Tennis elbow is a painful but often manageable condition that can significantly impact daily activities. By understanding the causes and symptoms, those affected can seek appropriate treatment early and take preventive measures to avoid aggravation. Whether through lifestyle adjustments, physical therapy, or medical intervention, it is possible to overcome tennis elbow and regain full use of the arm.